Hey guys, Dr. Lera here. Today I am here with Sunny. Sunny is a 1-year-old, 2-month pit, and the topic of the video today is going to be hypoallergenic diets. If you guys stay tuned, we'll get into what diets are hypoallergenic, why they're hypoallergenic, and what we can do moving forward. All right, guys. So we had a little snafu with Sunny. He wrapped himself up in the microphone cord and then dragged the microphone cord in some poop. Super fun stuff. That being said, we brought him back in. He needed to go anyways, and so he was just, we didn't want him to be out here if he didn't need to. In regards to hypoallergenic foods, so I don't know if you can see this pink ball over here. Just gonna try and use more props. But so normally, let's say proteins are the size of this ball right here. E, if you want to catch it. So what ends up happening is, yeah, we're good. What ends up happening is when they go ahead and they have hypoallergenic foods, they go ahead and they shrink the proteins down so it's harder for the body to recognize it. So let's say that was the normal size of a food. When they hydrolyze the proteins, typically, let's say as it goes down to the size of a baseball. Now, there's another level of shrinking the proteins down, and that's down to the amino acid level. This is actually a technology that was taken from formulations for babies. I know because I had to put my kids on something similar when they were having some acid reflux. And so what they do is the 3 or 4 different prescription dog food companies have their own products. So you have Royal Canin has hydrolyzed protein, you have Purina that has HA, and then you have Hills that has ZD, and then they have Blue Buffalo just came out with a product recently, a hydrolyzed protein product as well. The amino acid level stuff, Royal Canin has a product called Ultimino. Purina has a product called Elemental. And I'm not sure if Hill's ZD Ultra is the equivalent. And so the issue with the ones that are broken down to the amino acid level, those are not all recommended for growth. I can tell you for a fact that Royal Canin, their product, you'll have to wait to put your dog on it till they're about 12 months old. If you have a giant breed dog, you may even wait till about 2 years old. Purina just came out with this product Elemental, like I was talking to, maybe within the last 6 to 12 months. And that is something that is actually approved for dogs that are growing. Now, I'm not sure if it's safe enough for like 8-week-old or 3-month-old puppies, but I'm almost certain it's good for puppies that are at least 6 months old. I think that's the case also with the hydrolyzed protein. That's something that usually you want to get them on that around 6 months of age. Now, what I tell people and what the statistics have shown is that with the Ultimino and probably the Elemental, these foods have an 80% success rate within 6 weeks. That means if everything else is taken out of their diet and you're just giving them their hypoallergenic food that is broken down to a amino acid level, then within 6 weeks, 80% of those dogs will respond. Within 8 weeks, you'll have 90% of those dogs will respond. And so that is something that means that there's another 10% of dogs that may need another 4 weeks to respond, or they may not respond at all to that particular food. That being said, some of the drawbacks, the hydrolyzed protein, so the baseball-sized protein foods, they have a dry and a wet version of each one of those foods versus the amino acid level breakdown foods. They only have dry versions of those. Okay, so that's something to be aware of. Now, we used to think that when they were going ahead, or what was told to us was that when they were creating these new foods, that it was something that would help in regards to not having to get these really odd or exotic proteins like crocodile, kangaroo, rabbit, even venison. And during the pandemic, we've seen that's been an issue either way. So don't think that it's not going to be an issue. The other thing I want you to be aware of is when you look at the back of these bags, sometimes you might see chicken or whatever, and people will think that they can give a chicken-based product or a treat. That's not necessarily the case because that food is broken down to such a level for the body to not having a reaction to it. You will actually not want to give them those treats. You'll want to stick with those particular foods. Now, normally the dermatologist will say that fruits and vegetables are not usually the things that cause allergies. So if you really want to give your dog something, you could try maybe giving them some blueberries, raspberries, strawberries, maybe even carrots or apples. Those are some different things that are vegetables, but or fruits rather, but we don't think that they would be causing any sort of allergies or anything like that. At the end of the day, honestly, I don't particularly like the ingredients in the food. I do think that some of these products have like corn or soy or whatever. And although they are great to help us determine whether or not these patients actually have food allergies, long term, I probably wouldn't leave my dog on these particular foods because they have a bunch of fillers and stuff that they wouldn't normally be eating. So usually what I will do is once the patients have been good for about 4 weeks, then after that point, and I'm not saying 4 weeks that they've been on the diet, I mean, they've been on the diet for 2 months, 3 months, symptoms are resolving or resolved, and now we have 4 weeks where their skin looks great, they're not having any diarrhea, vomiting, itchiness, anything like that. Then if you want to start introducing one protein source at a time and seeing how they respond. So what do I mean? Introduce a piece of chicken. Oh, no, my dog's having ear infection. Okay, I'm gonna introduce some beef. Oh, no, my dog's having diarrhea. Okay, let me introduce some fish. Okay, they seem to be doing okay. Let me give them some more. Okay, they seem to do great. Perfect. Then the next step would be to go ahead and find a food that aligns with your philosophy and then try a fish-based food. If you find that that food doesn't work, now you got to find another food. You may have to go back to one of those hypoallergenic diets and then start again. So be aware of that. Once you find a food that works, then you can go ahead and compare the ingredients on that bag of food that does work to the other bags that don't work. And then you can try and see what is potentially causing those issues. So hopefully this video was something that was helpful for you guys in determining what are the hypoallergenic diets that are available and also what the process is like. If you guys have any questions or comments about this particular video, please leave it in the comment box below. If you found this video helpful, please give us a thumbs up. And if you know somebody who needs to watch this, please share it with them. Remember, sharing, commenting, and liking the video really helps with the YouTube algorithms. Also, if you guys did find it helpful, also please subscribe. Thanks for watching and have a blessed day.